All right, well, let's get started. Welcome. Thank you everyone for joining us today. I'm Kristen Leathers. I'm a Senior Vice President and the Healthcare Practice Lead at V2 Communications. Thank you again for joining. It's been an exciting couple of years in healthcare, to say the least. It's been about 3 years since COVID first came to the US. And I think a lot has happened in the industry since then. You know, we've seen that the pandemic highlighted a lot of holes in our healthcare system, but it also accelerated a lot of positive change in terms of how care can be better delivered with technology. So as we are now in December and wrapping up 2022, we figured now would be a great time to reflect back on the biggest industry news and trends from the past 12 months. And talk a little bit about what is going to be most exciting as we go into 2023. And we figured who better than to join us in this conversation than the journalist covering healthcare news and trends every day. So I'm very happy to welcome Gabe Perna, Innovation and Tech Editor. Deputy Editor at Modern Healthcare, and Eric Wickland, Innovation Tech Editor at Health Leaders. So thank you both for joining.
Yeah, thanks for having us. Appreciate it.
Glad to be here.
Great. And Patty Pin-Manaban, unfortunately, was also supposed to be here, couldn't make it. He's feeling a little bit unwell today, flu season. But definitely be sure to check out his podcast, The Big Unlock, as well as his articles in Forbes. So to kick things off, Eric, Gabe, I'd love if you could just give a quick introduction to yourselves and what you cover at your outlets. So Eric, do you want to kick us off?
Certainly. Yeah, my name's Eric Wickland. I'm the Innovation and Technology Editor for Health Leaders. So pretty much explanatory there. I cover technology and innovation with the understanding that innovation doesn't always have to mean technology, but usually does. I've been in this industry for like 15, 20 years with med tech media, with HIMSS media, with Extelligent media, focusing a lot on telehealth, digital health, connected health. A lot of terms and phrases out there that are very close to meaning the same thing.
Great. Gabe, how about you?
Yeah, so I'm the Deputy Editor of Digital Health Business and Technology, which is the brand from Modern Healthcare that covers the digital health industry. We look at both kind of the technology and the finance side of digital health, which obviously there's a lot going on. These days, like Eric, I've been doing this for a little bit, maybe not quite as long, but you know, a good amount of time too. Started with healthcare innovation, then informatics, was over at physician's practice, and then was recently at Health Evolution. So I've been covering health tech for a while. It's an exciting space. It's always changing, and this year was certainly no different. So yeah, I'm happy to be here.
Excellent. Well, very much looking forward to this conversation. I wanted to start things off thinking back to what started almost 3 years ago with COVID was kind of the inundation of constant news and updates surrounding the pandemic and how that kind of turned the proverbial newsrooms on their head. I know, we're not necessarily going into newsrooms every day, but I'd love to kind of understand, how that has evolved in the past couple of years and what your bandwidth looks like today. Has it gotten any better than, where we were a few years ago?
I can start, and then Eric, if you want to go in. Yeah, I mean, I think when the pandemic hit in 2020, it was constant. You were looking up things every day. Things were changing. I think for a lot of people in healthcare media, it was probably like the most active event you've ever been a part of, because usually the industry is pretty 9 to 5, Monday through Friday. It doesn't kind of change that much, but obviously that wasn't the case with COVID. There was things going on all the time. I wasn't at Modern Healthcare at the time, but I know they had like people working around the clock for a while in the beginning stages of the pandemic. I think on the tech side, what has happened is telehealth has really gone mainstream and digital health has really gone mainstream. So now there's just so much more out there. There's so many more companies. There's so much more research. I probably get more emails now than I ever have. And that's probably true for everyone, like everywhere. But in terms of like getting pitches, in terms of getting story ideas thrown at me, it has never been this crazy. I went to health, and I think Eric, you were there too. I've never gotten more pitches in my life than for that event, which is kind of nuts because having gone to HIMSS a lot, like HIMSS is a bigger event from an attendee standpoint, but there were a lot of people at health, a lot of companies, a lot of startups in this space. So it's definitely kept us busy. Maybe it's normalized a little bit in the last few months as the economy is kind of taken hold, but it's still pretty crazy. So I don't know if you agree with that, Eric.
Yeah, the pandemic really pushed healthcare and journalism into the spotlight because of everything that's going on. I think that the traditional newsroom, I think, has been kind of evolving for a long time. It goes long before COVID. I know I've been working remotely since long before COVID. We do have a newsroom, and people do congregate there maybe once a week, maybe once every 2 weeks. But it's more now the idea that this constant news cycle, you have to be on top of things. You have to be very careful about accuracy these days, and that's partly due to COVID, partly due to the political climate as well. It's just, your research and your sources need to be careful with them. And yes, the pandemic pushed telehealth into the spotlight like never before. We had gone from maybe 20% to actually closer to 12% telehealth use prior to COVID, as high as maybe 80% at the worst, at the height of the pandemic. And now we're back down to maybe 20, 30%. But it has proven the value of telehealth and digital health and so many different tools and technologies that you can use. And it's certain that these technologies will still be used in the future when we get beyond public health emergency. We just need to figure out, the health system, healthcare industry needs to figure out how best to use them.
Yeah. I already have so many follow-up questions based on what you two just said, but let's start at health and the fact that you did get kind of an unprecedented amount of pitches to meet with companies and specifically a lot of telehealth companies, it sounds like, at the event. So I want to start off quickly by asking about health, because I think a lot of the companies that we work with are kind of figuring out, do we want to put a ton of muscle behind health, which has quickly emerged as one of the biggest industry conferences? Do we want to put most of our resources and energy behind HIMSS? What do we make of Vive? Let's talk about that, because I do think there's a lot of questions surrounding those three conferences in particular and how to kind of think about each and where to put the most weight.
Okay, I'll start on this.
Yeah, why don't you start?
Health was crazy. It was glitz, it was glamour, it was Vegas. And for an industry that hadn't really had a chance to meet for the last 3 or 4 years, pretty much what we needed, maybe, just to meet old friends and come out of our shells and so on and so forth. Innovation, healthcare innovation, for that specific topic, health was a perfect place. Because of the conversations going on the floor, the presentations, the stages, and so on and so forth. There was a lot of discussion about how healthcare is being reimagined. And I know that was a phrase that I think HIMSS used as well. But I think with health, it kind of attracted the smaller startups, some of the more creative types. And I think going forward, it's going to be interesting to see how health evolves, is if it maintains that innovative edge to it and attracts the new ideas and so on and so forth. HIMSS is an establishment. It's been there forever. It will always be there. But I think we had this discussion the other day too. That HIMSS caters to the more established health care organizations and entities. it's been going longer. It's a little bit harder to find some innovative ideas there. You're looking for the established ideas.
Yeah.
Vive is an interesting mixture of the two. And then I'd also put in a pitch for the American Telemedicine Association, event, which also, it focuses solely on telehealth, and they're hanging on there. They've got some good ideas. They started up this past year in Boston again. For innovation, it's good to look in some of these smaller areas, the smaller margins, just because that's where these types of things they benefit the most. With smaller audiences where they can slowly build up and grow, and then when they get big enough, go to HIMSS.
Yeah,
the big kids conference.
I mean, health, there's a lot of excitement there. I agree. Very glitzy, a lot of glamour, kind of a cool factor. I mean, I don't think you're seeing ludicrous at HIMSS. Maybe not, but it definitely had a different vibe to it. Almost, I mean, you can't say it's apples and oranges because there are similarities and there are people who go to both conferences, but a little bit different. I think, to Eric's point, HIMSS is very much about like almost established ideas and like really in the weeds, like about things like interoperability and fire, and health is more about like startups kind of coming together, coming out with their kind of innovative ideas, different exhibitors, not a lot of, there was a few end users like health system people and insurance companies there. And I said to them, I was like, you must get like harassed at this show. like I thought I had it bad, but like you're a potential buyer here. That must be crazy. So I think, definitely there are more buyers and end users at HIMSS. But there's a little bit more excitement, kind of a new kid on the block feel to health.
Right.
I think there's value in both of them. I think health might be a little bit more in flux because a lot of the companies there are in, maybe not as established. They're not Cerner or Epic. They're not, making these profits. They're startup companies. So it will be interesting to see how many return for Health 23, how many have to cut back on marketing. I know a lot of them cut back on marketing in general because of inflation, because of the recession.
Right.
So I'll be interested to see who kind of shows up next year. Whereas, like, I feel like we know who's going to be at Health. I mean, at HIMSS. It's going to be a lot of the companies that have been there for a while. But both have value. I haven't been a Vive, so I can't really speak to that one. But I agree there. There's value in a lot of these conferences. There's only so much time you have on your hands. And certainly, not a lot of money just to throw around to travel the country.
Yeah. We haven't even talked about CES too.
Right, exactly. CES is becoming more of a healthcare conference.
Right.
100%. Yeah, that's a definite contender. Obviously, on the finance side, which I cover, JPM is a big conference. I think what was interesting about health is there was a lot of finance people there. Walking the halls of the Venetian, saw a lot of people from venture capital, private equity. Those types of people were there. I feel like that's almost like the JPM audience that health is kind of going after. Whereas, like I've said, the HIMSS audience is way more end users there. So
Well, I do want to talk a little bit about the financial aspects of the industry, because obviously we're in a very different place than we were last year. Last year we saw a ton of M&A activity. We saw a ton of money being poured into these companies. Now, the landscape has shifted. We are now kind of officially into the recession. How does that change your reporting, apart from presumably reporting on fewer deals? How does that shift your reporting?
So I'll jump in here because I know Eric doesn't do as much on the finance side. But first I would hold on the recession word. A lot of people, when I say that, they get very like, it's a controversial word. People are very hesitant.
Right.
A lot of people like to say market reset. Whatever it is, we know there's just not as much money going into health technology in 2022 as there was in 2021. And by all indications from what people are saying at health and what they've been saying is 2023 will be even worse. It will be even more challenging. So yeah, I mean, yeah, there's fewer deals. The raises are just not as gigantic. I think there's a lot of like talk, like maybe that's a good thing. There were some outrageous deals last year, some funding rounds that were 300, 400, 500 million, companies getting valued in the billions that obviously weren't profitable, but like some of them didn't even have a ton of users. So it's kind of like, where are we getting these valuations from? It was a free money era, as people have said. That's gone. It's definitely a little harder. You know, my mentality is like, if we were covering your awesome funding round in 2021, we're covering your crappy layoff in 2022, because like you know, it's part of the story here that you were getting a lot of money, you grew too fast, and you're not profitable, so now you have to cut back.
Yeah.
I know it's kind of gloomy because, you know, it's a lot more fun when people are raising money and feels like things are happening. But that's the economic cycle. I think most people I talk to aren't like surprised by it. They say this is what happens. It's happened in the early 2000s, the dot-com era. It happened in late 2000s. A lot of people have not gone through it because our economy has grown for a while now. So it's kind of like, oh yeah, this sort of thing happens.
Right.
I do think it will be good, because I think the companies that are solid, that do have good quality outcomes, that can generate profits, I think those companies will come out of this pretty strong and ready to make an impact. And there'll be certainly more of those companies than there was before 2020, when this all started to really explode.
Yeah.
And to that point, you know, what are the health technologies that you're most excited and optimistic about? Like, what are the ones that you feel like are truly changing the game in healthcare, whether that's, you know, something that health systems are using to streamline operations internally, whether it's something that's potentially patient facing? Like, what is making you feel really excited and interested as a subcategory?
Actually, I was just having a conversation with the CIO about this, about the landscape for 2023. And just to kind of piggyback off of what we were talking about here. Yeah, the innovators, the companies, the small startups and so on, they had so much money to play with. So they were very showy, and they expansive on their ideas and their concepts. Now we're looking, and I deal with the health system leaders, the CIOs, the CEOs, the decision makers in the healthcare landscape. They don't have the money. Their operating margins are slim, if negative. So, and there's not going to be a lot of money in the coming years for innovative ideas and projects. What they want to see is the technology that will work. And we keep going back to this phrase, value-based care, meaningful use. They want to see these products actually work. They want to see the evidence that these will do something. They'll move the needle before they'll invest in them. They'll try them out. So what we're going to see in the next year is a focus on technologies, and we all talk about AI, which is popular. Telehealth technologies, digital health technologies, automation is probably one of the catchier phrases right now. Technologies that improve the workflow, because of improve the processes to cut down on stress and burnout in health in their workforce, that make operations easier to manage. And also technologies that improve, and this is a big phrase, patient access. Anything that can get the patient to the provider quicker, easier, because we've seen it through the pandemic that access is a major issue. It's not just in-person care anymore. It's not just care in the hospital or the doctor's office or the clinic. It's care being expanded into the home or into the workplace and other locations. So we're going to see these technologies and platforms, the ones that actually do this and that actually improve patient access to care, patient access to providers, and actually make the process easier on the back end for the staff, for doctors, nurses, so on and so forth. And also we'll bring in payers and, paying processes as well. Those are the ones that are going to be focused on, and they've got to make a difference, and they've got to prove their value to be adopted.
Yeah. So as you're evaluating, different technologies and the true value that they do deliver to health systems and physicians and ultimately patients, what are the sources that you need to speak with to kind of understand a story, or I guess that's a funny way of putting it, but understand whether a technology is actually as credible and impactful as maybe the providers make, and when I say provider, I mean the technology provider is making it out to be. So I know we talked before, you do need to talk to health systems. So with that, is there a specific title that you look for within health systems? Are you looking to talk to the chief medical officer? Are you looking to talk to an actual physician? Are you looking to talk to patients? Who are you most interested in speaking with? Or it really, is it kind of flexible and dependent? I'm sure it's some combination, but.
It is flexible. I mean,
I was going to say the same thing. It really depends. I think it really does.
Yeah.
I think there's a lot out there that we just assume, the CIO or the CDO or the CTO is going to be responsible for that. And that's true a lot of the times. But there are things that they don't really even touch.
Yeah.
We were talking about staffing. That's you would want to talk to the CHRO, the Chief Human Resources Officer. That's the person that really cares about that. I mean, they all care about it, obviously.
Yeah.
But that's the one who's probably implementing it and judging it. So I really do think it depends on what kind of technology, what kind of story you're writing.
Yeah.
And that's true not just in health systems, but with insurance companies, with pharma companies. Every company, every technology is going to be run and operated by a different person.
Yeah.
And patients, I mean, if I could talk to patients, that's always great, because I do think their voice gets lost way too much in our reporting and just in general. I mean, these are the people who are affected by it. I did an article on Hospital at Home. And there was a patient for UMass Memorial who I got to talk to. And it's just a cool, different perspective that we just don't really get a lot in the trade press, because we're just focused on the end users.
Yeah.
But I do think the patients, that voice matters, and it really, helps flesh out a story.
A quick plug, that was a V2 client, Current Health, who works with UMass, and that was the patient. So that's great that you mentioned that. But I think one of the other things that we talked about in our prep call was the movement to care at home. That is a big trend that's happening right now. But also, health systems do need to be incentivized to offer those hospital at home and care at home programs. And right now that is a challenge, because reimbursement models and policies don't necessarily favor, the movement home, or they may not once the CMS waiver, is up. So I would love to talk a little bit about that and what you think, to what extent you're interested in talking to policymakers who are kind of shaping some of the future of a lot of these technologies and programs enabled by the technologies.
Yeah. Well, UMass Memorial is one of 220, 230 health systems that are involved in that hospital at home program, which is organized by CMS through a waiver that granted through the pandemic. When the pandemic public health emergency ends, that waiver ends, and hospital at home is going to undergo some changes. I mean, it's a great idea. the idea of moving more patients into the home and caring for them there.
Yeah.
But it's a very complicated and technical process in many cases that won't hold up without the CMS waivers and the reimbursement.
Right.
On a broader note, the idea of remote patient monitoring is big.
Yep.
CMS is reimbursing for what they call remote therapeutic monitoring and remote physiological monitoring. They're smaller subsets of RPM, and they're separating that from telehealth. It's an entirely different movement. But the idea, again, of more care being provided in the home, moving out of the hospital, clinic, doctor's office, the ability to connect with and monitor and collaborate with patients in their home at any time of the day, to spot trends as they're happening at home and act on them immediately to avoid adverse health conditions down the road that lead to much worse outcomes and so on and so forth. Yes, reimbursement coverage, payer coverage is an important aspect of that, because hospitals, doctors, so on and so forth, they're hesitant to kind of embrace these new ideas, these new technologies, without getting a little bit of a support, financial support for them. And so CMS is slowly going to come along, and they want to see the evidence that RPM works before they go to reimbursement. On the other hand, we're getting a lot of payers now, a lot of health plans that are very interested in this, and they'll jump the gun and they'll start supporting these services. You've got health plans that are supporting Fitbits and remote and wearables and so on, just as a means of improving health and wellness, which is part of the new definition of healthcare. You're going beyond just episodic care. You're including preventive care and health and wellness and so on and so forth. As we move in that direction, we're going to see more of these innovative programs catch hold, and payers are going to be interested in them. They've got to prove their value. You've got to see the studies over time that prove that a Fitbit monitoring will knock down the A1C level for a person living with diabetes, or improve activity for someone with cardiac issues, COPD, so many different ways. You see the payers get involved, you see them supported. More and more health systems, I think, will follow suit as well.
Yeah, I'll just add on to that. I think there is a lot of experimentation, but I also think that Medicare kind of sets the tone. I mean, a lot of the patients who need to be in these programs, who would have a length of stay in the hospital that could end up being costly, are people of Medicare age. And there's a saying that, like, nothing happens in the payer world without Medicare doing it. And I mean, that's because they are paying for the people who end up typically costing the system the most. And yeah, without that payment, a lot of these hospital at home programs are just not going to be able to continue at the same rate. It's just impossible. The costs are too much to maintain. You really need some expertise. So it's something that we do watch at Modern Healthcare, that you have to. I'm not a fan of regulatory coverage. I'm scarred from like meaningful use days. It's definitely not my favorite part of this job, but you have to, because so much of this industry relies on what happens in DC with CMS and with regulation. So, if they're not going to get paid for it, they might do it, but it will be at a much smaller scale, not as impactful. So yeah, definitely something that we'll be watching in the coming year. It's connected to the public health emergency. So when that ends, and I feel like I've been saying this for a year now, but hypothetically it should be ending. And when it does, I think it's like a 60-day, or I'm sure I might be off on it, maybe 180 days, or a certain period of time. They'll have a little bit of a window, but then it's over, and it will be interesting to see what happens.
Yeah. So we've talked about care at home. We've talked about care access. Beyond those things, what do you think are the trends worth watching? I know we talked briefly about behavioral health as something that kept popping up at health. Is that something that you're particularly interested in? We talked about interoperability, which is maybe less sexy, but still
Not as
very
a-
much a
not as
reality.
fun.
Yeah.
Not as fun. I definitely think behavioral health, I mean, like, I think of the one area of telehealth that's taken hold, it is behavioral health. It's, the clinical specialty where you typically don't actually need to see someone in person. And I do think there's a lot of interest. There's a pretty vibrant direct-to-consumer space where there's a lot going on. Some of the companies people know about, and there's a lot going on there.
Yeah.
A lot in flux, I would say, in that area. But the reason that those companies have popped up is because there's a huge need for behavioral health. I mean, if you try to get an appointment with a mental health specialist, depending on where you live, it could take months. It could take a long time. There's a huge supply and demand issue there. And telehealth has proven to be a pretty good access point. So that will continue. I think there will be a lot of room for that, for, whether it's through health systems or whether it's direct to consumers. I do see that continuing. The market will probably shape out a little bit. I'm sure inflation has had an impact on it because it's hard for people to pay out of pocket these days. But it's definitely something I'll be watching for sure.
Yeah, we're in a behavioral health epidemic, piggybacking on a substance abuse epidemic, which both of those particular fields fit perfectly within the idea of digital health and telehealth to reach more people as possible, to break the stigma of going to an office or a clinic or whatever to get treatment. Obviously, the regulations around them are important. Yes, behavioral health has been the one really successful use case during the pandemic. So much so that this is the one area where there will be allowed simple phone calls to extend treatment. Everything else, people, the phone, what we call the audio only telehealth platform was allowed during the pandemic as a means of communicating and allowed for some treatment. Most of that's going to be wiped away, except for behavioral health, because it has proven it's been needed. As we go forward, we mentioned that direct to consumer. That's a fascinating space right there, direct to consumer. The idea of these, what we consider them telehealth vendors or companies, they now have their own provider. They have their own ranks of care providers. They become providers and they market directly to the consumer. Hospitals and health systems, they can feel endangered by this, and that there's more competition for the patient now. It's going to be interesting to see how that field evolves. There's going to be a lot of them out there, and there already have been that have just gone under, because you're trying to attract the attention of the consumer that's so about getting these types of services directly without going through a doctor firsthand. So it'll be interesting to see how health plans market these, how hospitals and health systems try to partner with some of these direct to consumer companies and create programs, platforms of services, specialized services, so that you walk into your primary care provider's office with a specific problem that the doctor doesn't necessarily have the expertise to treat. He may prescribe an app or prescribe a phone call to a certain a company like Roe or Hims and Hers and so on and so forth, and work in partnership with the health system to provide those services. It's going to be
companies that do sell direct to consumer. Have you ever, or would you be open to kind of trialing the solutions and services as a consumer? Like, have you ever done that?
I can't say I have. I mean, a lot of them aren't like, they're specialty ones for like specific problems. That seems to be the method that a lot of them go for, whether it's like hair loss or something like that. So I can't say I have, but I just wanted to piggyback off something Eric was saying, because I feel like, there's this element with health systems and health insurance companies and the incumbent health system to kind of like be like when Amazon does something or when a company in technology does something in healthcare and it doesn't work out, they're kind of like, ha, told you, healthcare is hard. And healthcare is hard and it is very complex. And it's not something that a big tech company can just disrupt like they could with retail. That being said, I mean, like there is so much more that's going to happen, not just from Amazon, but you see what CVS is doing. You see what all these guys are trying to do to reach people who are, quite frankly, interested in more convenient healthcare. You call up your doctor and it's like, all right, I can see you in 2 weeks. That's not going to cut it anymore. Like you have to be way more convenient, on point. When Amazon bought One Medical, often when I do this, I'm like, I don't even know if anyone knows who these companies are. So I was mentioning like, oh, Amazon bought this company, One Medical, to a friend who's not in healthcare at all. And she's like, oh, I love One Medical. I use them all the time. Super convenient. And it like made me laugh. It's like, yeah, there are people out there who feel like that. And especially younger people, they're going to lean towards that kind of. I think that's why you're seeing all this primary care M&A activity, and people are really trying to make an inroad in a space that they feel like the incumbent health system hasn't done the best job in. So it's something that I'll be looking at. I think we'll see a lot more movement in that space in 2023.
Yeah, they call it the battle for primary care right now. It is in some ways a generational thing. The younger generations, they want on-demand care. They want convenience. Convenience is a big thing now. And it will be interesting to see how hospitals and health systems react to that too, as they begin to offer branded services. But yeah, Amazon is roiling up the market. You mentioned.
Yeah, they're not giving up. I mean,
no.
They're going to keep going. And CVS is another one. There's a lot of companies who are not what you would consider a traditional incumbent healthcare.
And payers and health plans.
Yeah, look at United. Yep.
Self-insured businesses. I mean, the health spend for self-insured businesses is huge, and they're going to be very interested in these services that can reduce the healthcare costs.
Yeah. Do you find that you're more interested in speaking to, kind of these big and often untraditional players in healthcare, or are you equally as interested in talking to the scrappy startups that are, maybe Series A, Series B, but doing really important work?
It's tough. Both have their value, but there's a lot of startups. If I talk to all of them, like I wouldn't have a life. I mean, like when I say I get pitched a lot, I'm not kidding. Like I feel like when I close this out and look at my email, I'm going to see like at least 10. There's a lot of good startups out there. When I started, I was like, I always tried to make a point like to respond to people and don't want to be rude, but it's almost impossible now. Like you almost have to ghost people just because it's just, there's so much going on. So yeah, but I'll tell you, even like Google and Amazon, they have something going on, it might not be relevant and we might ignore it. So it really does kind of depend on what we're working on and what they're trying to talk to us about.
What kind of pitches catch your eye? And if it's not pitches, how do you come across companies that, you really want to talk to? Is it at conferences? Is it, through independent research? Is it from pitches from PR people? What gets you like excited, and how can companies kind of cut through the noise to kind of connect with you and at the very least have a conversation, even if it ultimately does not result in a story?
Well, as you mentioned before, the idea going ahead into 2023, we're gonna see a focus on innovation that actually works. So the pitches that I look for first are the companies that have partnerships with a health system, a hospital, that are already trialing their solutions in that setting. The ones because I want to talk to healthcare leaders. I'm talking to hospitals, health systems, doctors, so on and so forth, that are actually going to be using this technology. and I don't want them to tell me what the good stuff is and what the good stuff isn't,
Mhm.
and so on and so forth. So those are the first ones I look for. And that can, those pitches come anywhere. At health, the best conversations I had at health were at happy hour.
Sorry, say that again. We're what?
Happy
We're at
hour.
happy hour.
Oh, yeah.
Because
I know.
that's when we started just talking. I mean, yes,
Right.
on the floor, the presentations, our pitches are canned at the most part. Everything's been rehearsed and everything. You get away from the rehearsed stuff and just sit down and talk to people.
Yep.
And and all of these startups, they're very smart people that are doing this. A lot of them are in healthcare to begin with, and are attacking a very specific problem that they may have experienced in order to create this technology, this idea, this strategy.
Yeah.
But it's, again, it all boils down to, you'll have a great idea, it can save lives, it can, so on and so forth. But until it's actually put to use in the hospital or the clinic, the doctor's office, or so on and so forth, and that's what we're going to see from now on. It's got to prove its value by being used.
And a follow up to that, you had mentioned at the beginning, increased focus on fact checking and accuracy. Is that, do you mean, in terms of the number of customers a vendor say they work with, like, is that what you're referring to there, or
data? It all boils down to data.
Right. Yeah.
A lot of claims. You can make a lot of claims,
Yeah.
but like if it's not verified, it's what's interesting is like I'm getting more like provider or like tech company run like studies like that has really popped up. So I do think people are kind of getting that a little bit more than they may have in the past. I get a lot more of those. But I want to like emphasize what Eric said. Yeah, because like the happy hour, relationships are so key. I mean, like if I have a good relationship with someone, whether they're at a startup, whether they're at a big tech company, whether they're at a health system, I'm 100% gonna like talk to them. And often I talk to these people just like for the heck of it, just to see what's going on, not to like talk about a specific story. And that's where I get the best stuff from. 100%. It's from those kind of relationships that I formed over the years. So it's hard to break in because like, if you're not someone I've ever talked to, then it's hard to be like, hey, like, but if you're coming at me aggressively with a pitch and I don't know who you are and I don't really know who the company is, that's probably not going to happen. I mean, it might once in a blue moon, but I would say like relationships and just being able to talk could be off the record. Doesn't have to necessarily be about like, you could just be like, hey, what did you think of this deal? And I don't have to quote you, but that realness goes a long way. I think to Eric's point about happy hour, getting away from the rehearsal stuff is really where kind of I feel I get the most value.
I want to pause there for a second because I should have mentioned at the top of this call, if anyone tuning in has any questions, feel free to just put them in the chat and we can take time to address those. But I guess a follow-on to that point, Gabe, is, it felt like before the pandemic, oftentimes we might set our clients up with reporters, even for a lunch and off the record, just for the exactly same purpose you just mentioned, relationship building. Now people are more spread out. They're not necessarily going to an office as much. Do you find that A, you have time to commit to a lunch, a coffee, a drink with, an executive, and B, are you open to that kind of thing?
It's a little harder for me because I live in Connecticut and I know exactly, I have 2 young kids, so I'm not like someone who's like getting out, like whereas 10 years ago, it would have been a lot easier. That being said, I'm always open to that stuff. We have a New York office. I do try to go in to that office every so often for this exact reason, so I can meet people. Because one thing I got out of health and I get out of any time I'm in person is people are just so much more open. when you're talking to them in person, they're just so much more willing to share some of their insights that they might be a little hesitant to say on the phone. So definitely open to that. And like I said, it's a little hard with my personal situation, but I usually try to make it work because I do find so much value in it. So definitely.
Yep. Yeah, the stories are so much better.
Yeah.
And, I tell everybody that I go to a meeting or I go to health or HIMSS or CES or whatever. We'll talk for a while, but this is not an interview where I'm going to write a story from the interview based on that. It's going to be something that perks my interest. I take notes and so on. I get back home and I'm in Maine, so it's kind of hard for me to go out too. But it's a story. A story takes a while. It starts with that conversation, then we can do the interview on by phone, video, or whatever later on. That's when I get all the details or so on and so forth. So it's just these casual conversations, and I'm always up for coffee and so on and so forth. I think when we get all these pitches for health and so on and so forth, I'm thinking, okay, I can meet you for a cup of coffee in the morning before the sessions or so on and so forth, or we can get together for lunch or again happy hour. And I imagine now that we said this, we're going to get tons of pitches for happy hours for Vibe and so on and so forth. but just the chance to meet somebody face to face and sit there for a while and talk about the weather, or home, this or Vegas. We were having real good conversations about the crazy stuff we saw out there. But it's just a way to bond, communicate with each other and feel comfortable. And that's when the ideas start flowing. And then I'll say, okay, tell me about your company a little bit. And then tell me who you're working with, what hospitals, health systems, so on and so forth. You're either trialing your stuff with or thinking about, and then it just naturally goes out from there.
Right.
As I said, health, I've written a couple stories, 3, 4. I've got like 10 or 12 more stories that just came out of those conversations. And at some point I've got to do before, the next
anecdotes. Yeah. I mean, those are huge. I wrote an article this week. I was talking with Paul Markovich, CEO of Blue Shield of California. And I just was like, how was your session? And we got into this whole thing about scaling and how hard it is. And I was like, that's like a story right there that probably wasn't even pitched to me, but it was I found it interesting, just kind of talking off the cuff. That happens a lot, in person is huge for that. So definitely a fan.
Well, we have a few minutes left. I did just want to ask, what is the biggest trend, or what are you most looking forward to as we go into the new year? What do you think is going to be, what's going to redefine healthcare, if anything? What are you looking forward to?
Tough one.
Big question.
Going grand. I can start if you're still mulling that over, Eric. I mean, I don't know if anything's going to redefine healthcare, but I think the market's going to shape itself out a little bit. I think you're going to start seeing some stronger players that have emerged. No more kind of funny money, just solid companies doing good work. Disrupting healthcare is absolutely necessary. I mean, it's such a cliche, but it really is necessary. There are a lot of problems with this industry, and I think you will start to see some of the winners emerge, and I think that's an exciting thing. And we'll see more M&A activity. I'm certainly going to be on the lookout for all that. And I think it will be kind of an evolutionary year in a sense, because I think you'll start to see kind of the noises die down a little bit. All right, now what are these companies that are actually making an impact with health systems, with payers, with employers? Obviously, that's a growing part of the healthcare ecosystem too. So I think it's just kind of that how the market shapes itself out is what I'll be very interested to see in 2023.
What about you, Eric?
We spoke about not redefining. Well, yes, redefining healthcare. Healthcare is defined differently now. What I hope will be a trend, in that something that I've enjoyed seeing, is the phrase is the social determinants of health. health equity at the same point. The idea that healthcare is not just one episode. It's not just clinical anymore. It is your environment, your family, your job, your everything behind you and around you that affects your health. And so on the health floor, we were seeing 5, 6, 7, 8 different companies that focus on food as medicine. Combining diet and exercise with clinical care. Providing meals for people newly diagnosed with diabetes, so that to make sure they're eating properly, so that it in turn affects and improves their health. Best Buy was on the floor. Lyft was on the floor. The idea of transportation as having an impact on care, on healthcare. Companies that combine clinical care with child care, so that somebody can get to the doctor's office. Students accessing behavioral health services at school. Just so the trend, I guess, is the idea that healthcare is just not clinical anymore. There's so much more that can go into it, and by giving us these platforms where a primary care provider can tap into other resources to help improve care for his patients. I like that idea of that going forward. I like to see more of that. And that's going to be fun to see how, all the way down to this little trend that I saw that was starting, doctors prescribing passes to the park, movie theater tickets, museum tickets, and so on and so forth, as a form of care, of providing care.
We do have a question from the audience, so I'll get to that. They are curious about the biggest buzzword in pitches from 2022 that you've seen in pitches that you'd like to see go away. And by way of example, they mentioned that they recently saw someone tweet that they're tired of seeing value-based care in pitches. So curious if there's any words or phrases that you feel like are potentially overused.
Well, they're all overused.
Right? All of the above.
Social determinants of health equity. Everybody's using them. Maybe that's a good thing. The one I hated for the longest time was reaching a tipping point. Telehealth was going to reach a tipping point and get to that point where, okay, everybody would accept it afterwards. There is no tipping point. It's out there. You're not going to see it. It's not going to be this one moment in time where everybody suddenly realizes, hey, telehealth is good. It's going to be a gradual evolution. You suddenly realize that your primary care provider is using telehealth, and that or the hospital is doing it, or this little tiny robot walks into your emergency room, and so you can talk with the doctor 3 stories up. Things like that, where you start using an iPhone app to someone dealing with a craving, a substance abuse issue, uses an iPhone app to connect with a peer, a care provider. It's going to be there. It doesn't have to be defined, and we don't have to use specific terms and phrases for it, unless, of course, you need CMS reimbursement for it, and then you have to use RPM, RTM, whatever. But there's so many. Value-based care is a very broad term because different people, different corporations, different entities value healthcare differently. So what one person values is not the same as what another person values. So it's a tough term to say it's being overused, but when you do it, you got to redefine value as well.
Gabe, what about you? Any overuse?
I agree with that. They're all kind of overused. We've all heard them a million times. I feel like one thing that's not really a term, but there's a lot of attempted optimism, and sometimes it's just you got to be real. The best crisis, innovation. I think I've heard Amazon became Amazon during the early 2000 recession. It's I understand that people need to spin things a certain way, but at the same point you also should be a little bit more honest and be it sucks that when the economy is like this, and it sucks when people lose their job, and it sucks that good people are out of jobs and companies are struggling. so I don't know if that's like a buzzword, but there's times where I just roll my eyes. I'm like, it can't always be positive. Sometimes you got to be a little bit more realistic. But I do think that's kind of the nature of the beast with tech companies, especially, are always trying to like look at the bright side here. But sometimes there's just not a bright side. Things are just, crappy.
Yeah, it's fair.
Sorry, I know we didn't want to do gloom and doom.
It's all good. This was an awesome conversation. Thank you so much for making the time. We will be posting this webinar on the V2 website, so you can check it out again there. And definitely follow both Eric and Gabe and their stories. They're really good, I promise. I'm sure you can attest. They're super knowledgeable at the space, have a lot of great insight to share. So again, thank you so much for the time and hope to connect soon.
Thanks everyone.
Thanks, everybody.